Well, welcome to the work group for the Greeley Evans School District 6 Board of Education. And we'll begin our work group the way that we always do, with board member comments and reports. And I think this week we'll start to my left and we'll let Ms. Mash go first.
Let's see. I did attend the Student Wellness Committee first meeting for this school year. It was a Zoom meeting, and we kind of went over, we got an update from the Student Health, now I forget exactly what, Student Health Advisory Council representative just let us know some team building activities, brainstorming for the upcoming year. They had a guest speaker from Mr. Torres from Greeley West, and had some conversation about anti-racism. The Student Wellness Committee created a goal kind of modeled after the Innovation 2020 plan. Kind of looks very similar with the colors and with the focuses of physical education, I think diet or nutrition, mental health focus, and then I think curriculum and how more of those health-related focuses can be brought into the classroom. So we did a lot of talking about how some of the things that were the goals are not possible with COVID changes and restrictions and things like that. So there's going to be ongoing work around that, how we can kind of refocus or retailor those goals. And then we also got the results from the Smart Source and Healthy Kids Colorado surveys, which are administered every 2 years. So they'll be administered again in 2021. But some of the focuses are based off those results. So I think other than that, that's all I have to say.
Mr. Talley.
I feel bad. I haven't really done much since our last meeting. I don't remember anyway. I feel like it's been forever. I do just want to shout out to the Greeley Tribune for their nice article, and to all the board members that participated in that. It was very well written and had some really kind words, and just goes to show how close we are as a board. As I was talking with the reporter, he did say, it's amazing that all of your board members are saying the same thing. And I was like, yeah, I mean, because we're a team. And then so it's just nice to see that from everyone. But other than that, getting back into the swing of things with a kid having homework every night. I forgot what that was like, and so you should hear the conversations that happen in our house. It's usually one-sided with me getting upset and him being like, I'm done. So it's fun having a 7-year-old. So if you guys want a 7-year-old, let me know and I will bring him over.
Can I trade for 2 teenagers?
No way. That's all.
Thanks, Ray. Ms. Pappas.
I have not done a lot either. I did go with Dr. Dattery to do a presentation at the Latino Outreach Luncheon a couple weeks ago, and it was really a good opportunity to share what's going on in our schools. There were a lot of good questions, very supportive group of people. So it was good to get back out and start to talk about District 6, and I think that's pretty much all I have done. So thanks.
Ms. Solis.
So haven't really attended any school things, but have just been keeping everyone in mind. I know even, some of our quarantine situations are challenging and taxing, and just starting school, a lot of this process is emotional and very, it's a lot. And so just trying to, encourage everyone to know that, we as a board are here to support them, and our administration has done an amazing job in, answering questions and trying to put people at ease. And this is a tough time. And so I just, I hope everyone just keeps trucking along, and I appreciate how safe we've been in the district, and any kind of questions we've had, we've quarantined. That doesn't necessarily mean that everyone that's quarantined has COVID, but we're taking those precautions, we take it seriously, and I appreciate everything that everyone's doing within the district.
Mr. Hafley.
I'm taking the lead from Ms. Mash and writing notes to remind myself. First of all, it's been great being in the 7 buildings that I've been in. Just kidding. Just kidding.
You can tell she thinks that possibly can, that might not be a joke.
Gosh, no. Hey, I need to thank and congratulate Channel 9 and the Success
Yes,
Foundation.
that was awesome.
What an incredible little piece that they did, and I hope that all the board members take a moment and not only thank the Success Foundation, but write him
Kyle.
and thank him for what he's done. Because, I mean, that means a lot to our students, and I thought they did a special job. I ran into, I can say a woman, because she wanted to compliment the board and Dr. Pilch for the ability to have maternity leave either 1 year or 2 years. And she is truly excited to be able to be home, but she's looking forward to being back next year, and she wanted me to express thanks. One of our lead teachers at Greeley West, that person and I went for a walk, and they couldn't say enough nice things about the plans that are in place to work with the COVID situation, and they appreciate the support of everybody who has worked on that so diligently. I had an interesting conversation with a parent who said, I'm not very technologically adroit, and they would have liked some type of communication as to how they could help their child, because they didn't know what to do or who to go to, and they would have liked some kind of, I don't know, in-service in distance learning for their child. And I don't know if that's possible, but they thought, that's something that maybe we ought to consider, and they're very appreciative of being able to be distance learning. I also would like to thank the Greeley Tribune. I thought the article was very, very well done and incredibly fair, and Kyler deserves credit, and I know, Ann, you've covered us a lot lately, and we appreciate the effort of you and the Tribune. I think that's great. Mr. Fall is, heaven forbid, he's also from Wyoming. He's from Gillette, he told me, and so we're delighted that he's here to assist us. And Dr. Pilch, I want to compliment you for making the decision to hire full-time counsel, because I know that will make a difference in your ability to do your job better. And so congratulations. I'm being serious, because I know over the course of time, and Ms. Myers, this has been a very challenging time, and you deserve lots of credit for keeping everybody up to date. And I appreciate all the quarantine updates that you send, and I think that you deserve credit for that. So thank you very much, and I apologize for being so long-winded today.
You're great. Thanks, Mr. Hafley. Ms. Mueller.
So I, like Ray, don't have a whole lot to report. I'm sorry I was not here. Well, I'm kind of sorry I wasn't here for the last meeting. I was up communing with Moose, and it was lovely. I do have to say I really appreciate all the efforts of your team, Ms. Meyer, about getting things on social media, and a shout out to my friend Kathy Azari, who had a great little piece on there about how she's still able to teach the love of music to our district students outside. So I'm super happy about that. And yes, the Success Foundation, I just want to urge people to know that that is an ongoing campaign. And so if people still want to contribute to the lunch fund, or I forget what it's called, but the fund to Food for Success, that is on social media, and it is still up. And that'd be great if we could wipe out that entire lunch debt. I know they raised over $50,000.
80. Over 80.
Oh, it's over 80 now?
Wow.
Oh my gosh, I have old news. Yeah, I have old facts. Okay. That would be terrific. And I really thank the Success Foundation. They do so much to support our district. I did talk to a couple high schoolers, and they gave me some good feedback about the start of high school. And one of the things I was interested in is just kind of how they were managing the sort of hybrid schedule, the going in for a day and being home. And all the high schoolers I had talked to actually were really finding it to be a very smooth transition. They were getting a lot done. They enjoyed it. They were glad to be back on campus. Wherever it happened to be, the two high schoolers I talked to were at Greeley West, but they were happy to be able to be back at least is it 2 days a week they're back? but that they understood the situation and they were feeling like the online work was really going smoothly. So I just heard positive reviews from students themselves engaged in the process. So that's all I have to report. I haven't been able to really visit any groups and do any presentations, but I look forward to that if anybody wants to hear from me. So.
Thanks, Ms. Mueller. I don't know that I have anything to add to what you guys have all said. I too appreciated the article in the Greeley Tribune. Appreciated a lot of your kind comments, and it's great to know that it is a group, as Ray said, that where there's mutual respect and admiration in the room, and just such a great group to work with. So thank you to the Tribune for that article, and thank you guys who participated. I couldn't. I was fishing or fishing but not catching on when that article was written. So
Michael, could I add one more thing?
Oh, sure.
I'm
Ms.
sorry.
Cox.
Were you done? I didn't want to interrupt.
Go ahead.
No, I didn't want to
No.
interrupt. I just wanted to catch you before you move on. I just want to say that I walk early in the morning at UNC, and I just have to do a shout out for the UNC students. It is 6 o'clock in the morning, and they are wearing their masks, and even if by chance they don't have a mask on, because there's really not that many people out, they put one on, and so I just want to do a shout out for that. So I don't know, Pepper, if you can share that or not, but it's much appreciated, so thank you.
Yeah, absolutely will. I will tell you, the students want to be there.
Yes.
So they're doing everything in their power to make sure they can stay.
Thank you. Sorry.
That's great. No, I would just add to that. I also received just thank yous from parents and small business owners who are just so thankful that we were able to open schools and everything that's been done to keep schools open. So continue to get a lot of positive feedback from the community, just saying how thankful that they are that schools are open, and we're thankful as well, just as parents. It's great for our kids to be back in school, and hybrid's not ideal, but it is way better than what we had in the spring. And it's so great that they have places to go and ways to engage their peers, and so we're exceedingly pleased. I think that's all of our comments and reports. So our next item is our quarterly calendar review and upcoming events, and you guys all have that printed out before you, I think. Everybody get a printed copy of that. So again, not a ton on our calendar. There is a CASB Fall Regional meeting on September 15th, and then we have another board meeting at the end of this month. Is there anything else on there that I'm forgetting that should be on there? Well, we do look forward to when we can get back to seeing some schools. So hopefully in the near future. But
Do we have something on the 22nd?
This is Success Foundation breakfast.
oh, we do have a breakfast.
Oh, Dream Team.
Dream Team breakfast.
Dream Team, sorry.
7 a.m.
Mea culpa.
Is there anybody that's connected to the Dream Team?
Thank you, Rhonda. Okay.
Dream Team breakfast on the 22nd. Any others that we're forgetting? That I'm forgetting? All right. Well, our next item is our update on COVID-19, the response and opening of schools. And so, Dr. Pilch, I will give it to you.
Thank you, President Matthews. Well, Christina's getting that set. I will, just to Mr. Hafley's question about training for parents, we did offer multiple orientation sessions for parents in English and Spanish both. And there's also a recorded version on our website, I believe, that parents can still get access to. And if parents are struggling, they should reach out to the folks in the online learning program department and get help with that. We are also planning, based on some feedback from Araceli Calderon, she gave me some great information last week. We met about some of what she's hearing parents need. So we are planning to implement a walk-in kind of help desk that parents who don't use the phone to get help or don't send emails to get help can actually walk in at some in the morning and some in the evening. I think Stacy's team will work on that. So there'll be some opportunity for those families too who need some help when they're struggling with technology. And it may be too, Mr. Hafley, that it was a family that went, when we went remote with a school, that they haven't had any training, and that is very likely. We have not done as much we have not done a district-wide orientation for parents to technology. That's been site by site. As a school goes fully remote, the teacher calls every family that first day that they're out. They call every family to check in on the computer, the internet access, and just make sure that they know how to help their child to get logged in and checking in with every family. So there's other feedback around that for me. I thank you for it and appreciate it.
Well, I will share that with that person, and I'll have them refer to our website, and I appreciate that information. Thank you very much.
And now, if they are a charter school parent and they're online, that could look very different if they're not in one of our District 6 schools.
They're in Chapel.
Okay. All right. I think we're ready, Christina, if you want to go ahead and share the screen. Tonight I'm going to talk a little bit more about data that we're seeing here in the school district. It's a little different than updating you on programs and those pieces. So I thought I'd start with just talking a little bit about the numbers and where we are with the numbers and providing perspective on that. I know you're getting notice every time we quarantine a cohort or more than a cohort, but we have 39 of our 41 campuses are currently in person starting tomorrow. So 95% of our campuses are in person. We have 2 of our campuses, so Madison Elementary and Billy Martinez Elementary, that are still, that have gone fully remote. So 2 of our 41 campuses are currently remote, so 0.05% are fully remote. So that's 713 students at Martinez and Madison who are fully remote. And I want to be clear, we went remote at Martinez and Madison because of the high absenteeism at those 2 schools and the symptoms we were seeing. We did not have, and I don't think we still do have, a positive COVID test or a diagnosis from a physician that says it's probable for COVID. But we were seeing absences double in just one day. So we went from 10% of students absent to 20% at Martinez, and at Madison we had gotten up to 30% of our students absent. And so lots of sneezing and coughing and sore throats and headaches, some vomiting. And so we at those 2 schools we felt like we had enough concern over the absenteeism that we needed to go remote. At Madison, we had just quarantined 4 or 5 classes, and then really did an analysis of the absenteeism and what families were saying when they called in with their students absent. 392 additional students currently, as of tomorrow, are remote due to quarantine. So that's the students who are actually in quarantine. The students have been told that they are being sent home because they either have, I should have said quarantine or isolation, either have a probable case of COVID or they have a high likelihood of exposure to COVID because of that probable case of COVID.
Can you explain the difference between quarantine and isolation?
I can. Isolation is when you actually are you're positive for COVID or you're exhibiting symptoms of COVID. So 2 major or 3 minor symptoms of COVID. We recommend isolation. You're treated as if you have COVID, and you really should isolate as much as you can, even away from other people in your own home. So that's isolation. Quarantine is when you have been exposed and we're saying to you, you need to go home and quarantine to prevent the spread of COVID.
Okay.
So Jackson Elementary had been out fully remote the last 2 weeks. They returned today. Frontier Elementary has been out, and they return tomorrow back to full in person. And then I had mentioned Martinez and Madison. They will be out until September 24th. So as of today, tomorrow, 13 cohorts from 9 different campuses in the district have been quarantined and have returned as of tomorrow. So 0.012% of our students in the district had been quarantined up until tomorrow. So that's 277 students. This number includes charters as well as non-charter, every campus in the district. So I say campuses because Gap is a campus, and then we have 2 early childhood campuses, the ABC and then Early Childhood East campuses are included in that. We have 17 cohorts starting the 16th. 17 cohorts where they're out through, let me start over. We have starting tomorrow, there are 17 cohorts still out who will be returning at some point between Wednesday, the 16th, and September 28th. So 17 cohorts from 10 different campuses currently quarantined. And then that's 0.17% of our students, or 392 total students quarantined. I want to clarify that does not include the Madison and Martinez children who were just sent home and asked to quarantine. It does include those cohorts at Madison and Martinez where we actually believe there could have been high exposure for COVID. And then in terms of our adults, and I don't have the charters in this number, I work forward in the future to have the charters in it, but we have had, since August 25th was our first quarantine, we've had a total of 126 adults be quarantined. So 0.048% of our staff, or about 126 of our roughly 2,600 staff. I do want to tell you that in that number of 126 is also some University of Northern Colorado students who were doing practicums or possibly student teaching, but they're not, but we're including them as the adults who are in our buildings. As of tomorrow, we have 83 adults currently quarantined, or 0.031%, so 83 right now currently quarantined. This has been one of the biggest complications of being open and quarantining, because every time we quarantine a cohort, it's typically, I think the smallest I've seen is 2 teachers, upwards to, I saw at one school it was 7 staff who had come into contact with that cohort where the individual was either positive or presumed positive for COVID. So we end up sending out multiple adults along with every cohort that we quarantine, and that's been one of the toughest parts about making sure we could stay open. You may recall that part of closing Jackson was the number of adults we believed we needed to quarantine at Jackson, and just knew we wouldn't be able to keep business running as usual, in addition to the worry about spread there. So we have deployed some district administrators out to buildings to help cover some classes and to be in the classroom with students while their teacher is quarantined, and maybe teaching remote back into that classroom. So that's been the hard, if we get down at take an 8th grade level at a middle school, 2 cohorts out, you've now taken out probably 8 teachers. You get to a 3rd, 8th grade cohort, we've taken out probably 12 to 15 teachers. So that, that's a lot of staff out. And substitute teachers are not as interested in coming to buildings where we've had to cohort and quarantine staff. So that's been one of our biggest conundrums, and I will tell you, that's probably my biggest worry probably with us being able to remain fully in person is, if we've got to have the adults to run the schools. The teachers are the secret sauce and the other adults in the building. So lots of people covering classes and making this work. So just to kind of think about the schools that have been impacted, 18 of our 41 campuses have had at least one individual quarantined. So 23 campuses have not had a quarantine. And in some cases, this may have been someone who actually never returned to work in August because they were already quarantined. It could be an individual that went out and was absent and then became sick, and so they stayed home, but they didn't cause a quarantine in the building because they hadn't been present in the school. I will say this, that cohorting is working. We, for the most part, we've been able to keep most of our schools open most of the time because we send a cohort home, or, a couple cohorts home rather than having to close an entire school. And again, this piece of the staff are most impacted when a cohort gets quarantined. I can't say enough about our teachers and how truly remarkable they've been, and our administrators and our support staff. Parapros, another support staff covering classes to keep schools open and to keep education moving here. It's been remarkable. Our teachers, they are amazing. They are amazing. They have pivoted quickly when they've had to go remote. They've adjusted so that some of them are teaching remote from home because most of them are not sick. And so they can teach from home and teach their students who are remote, as well as the students who are back in the school who are their students. That's at the secondary level. So the teachers have been truly remarkable, and have really, really been the heroes in this. So around, what are we seeing in terms of cases as of today? We have 15 confirmed student cases in the district out of 22,260, whatever, actual confirmed. So these are cases that have actually come back as positive COVID cases, and 9 confirmed staff cases in the district. We have multiple pending tests out there, or pending symptoms really over 1,000 students and staff who we are contact tracing on for follow-up on symptoms and testing. We are following the guidance from Colorado Department of Public Health and Environment exactly as it is written. We are. And that guidance is that if you have 2 major or 3 minor symptoms, I think it is, and they don't resolve within 24 hours, then we need to go to quarantine unless we have a negative test and an alternate diagnosis. So, I do think some districts are bringing students back when they have a negative test and the alternate diagnosis is absent. We have not done that. We have asked our medical providers in the community. Our nurses have reach out to them frequently, asking them to please provide us with a diagnosis, or to say it is not COVID, so that we can allow the student to come back or the staff member to come back. The negative test alone has not allowed people to come back who have been symptomatic or who've been quarantined. So that is still a place where we struggle some, and I think people are very frustrated. I was on with a staff last Friday morning who said, we have this is a negative test, and yet we're quarantining a cohort, and there's a negative test. How can that be? And why can't we trust the science of the test? And we are following CDPHE's guidance. Their algorithm indicates that unless we have an alternative diagnosis or symptoms resolved in 24 hours, we can't bring them back. So that's been really tricky, and I'm happy to talk about that more. Natalie and I have had a lot of conversations about this over the days with her working in the healthcare field. This piece has been really tricky. How did we do with our asymptomatic testing of employees? Last Tuesday, we had 63 employees who signed up and were tested. I think there were 80 spots, so we didn't completely fill up, but results were returned within a day or two. At this point, we have no positive results out of that testing. Then Friday, 60 more employees were tested on Friday. I would guess that those results have come back. We're 3 days out, but I haven't heard of anyone who has said, yeah, I got tested Friday, I got my result back. We also don't have at this point, any positives out of that testing. We plan to do more testing on September 17th, September 22nd, and September 24th. These are free tests for district employees who are on our district insurance, employees who are asymptomatic. And then we'll work to set dates in October if there's still an interest in having the availability of testing in October.
Staffing,
Banner Health is doing the testing for us, and they're doing the PCR test. Banner Health is. So I want to talk just a little bit about Weld County, and I actually have a work product for you all of some data staff and I are keeping track of. You see some blanks because we weren't keeping track of the data at that point, and we couldn't get to it on the Weld County dashboard. But just to kind of look at what's going on with the Weld County positivity rate, I did have a conversation last week with Val at the epidemiologist at the health department to visit about numbers. I think we have a typo. September. I don't have September 8th on there, but I have it here. So if you had September 8th up there, you'll see it on this chart. What you'll see was on September 8th, we had a positivity rate of 4.15%. And so I saw that increase from 3.65 to 4.15, and I reached out to the epidemiologist to say, does this concern you? She continues to say, no, that doesn't concern me at all. I asked the same question again today in a meeting with Weld County. Cindy Kranagi, Dr. Kranagi, who was here at our board meeting, was on there, and Val Smith. Several Weld County superintendents were on the meeting today. They are still optimistic about the positivity rate. They said we're good as long as we're staying below that 5%. That they feel like these numbers are, in a good place for us to continue to be open. They did acknowledge that more individuals are being tested, so that's probably a piece of this increase up to the over 4% in the positivity rate. Is we're just getting a lot more testing done and a lot more testing back. I quote Val saying, not at all concerned about the positivity rate or the rate in 0 to 19-year-olds. We're under 5% in positivity, and we're seeing 0 to 2 cases an average. They're calling it an average of 1 case a day in a 7-day period for children 0 to 19 years of age. The county is going to start providing superintendents with a weekly report. I don't know how soon that'll start, maybe as soon as next week, but a weekly report of different data pieces. It's kind of like what I'm putting together here, quite frankly. And then, we'll consider the Denver Health Institute recommendations in the coming weeks. I shared that all with you in your weekly memo in the past. That is the document that would say you're green and good to be fully open. Yellow, you might use caution and consider going partially remote, or red, close. Those recommendations provide metrics around some of the pieces you see here. Looking at hospitalizations, looking at numbers of new cases, looking at the cases per 100,000, the average per 100,000. And then we're still waiting on new guidance from Colorado Department of Public Health and Environment. We had been promised that guidance after Labor Day, so it's after Labor Day. So we're still waiting on that guidance and are, very hopeful that guidance will help us a little bit with right now, if you are together like us and you're together for more than 15 minutes, even though we're socially distanced and we're in masks, their guidance right now would cause us to all be quarantined if one of us was positive for COVID. And so superintendents have been pushing back and saying, really? If we really are 6 feet apart and we really are wearing masks, is it appropriate to quarantine everyone in that classroom? As I look at our high school classrooms, in most of them, they are able to be more than 6 feet apart. High school kids are not bouncing around the classroom like elementary kids are. You probably can really determine who was within 6 feet of each other, and who had masks off if they did at some point. So that's a piece we're looking for some more guidance on, as well as this piece around validity and ability to really use a negative test to allow people back in, and rather than having to have an alternative diagnosis and the negative test. So I just want to share with you a little bit about what it looks like with the personal protective equipment. I know you guys haven't been in schools, but it all started with pallets and pallets of deliveries of the equipment and the materials, from additional instructional materials so kids don't have to share materials as much, to athletic equipment, to who knows what's in those boxes. But I think we have deployed a great deal of support to schools. This is what the air purification machines look like. Every classroom and office has one of those. There were some questions about, see that little blue circle in the middle? Some of the machines, when that machine is working harder, it changes colors. So ours up in the office, when you walk by it, it would turn red or orange because it was working harder to clean the air because we were kicking up dust from the carpet. So that caused some worry from some of our staff saying, my machine is red and orange all the time. And so we learned, we got to educate people about what the machine is doing. And so we worked to do that. It should be changing colors. It should be working. It is not a COVID or viral detector of any kind. It doesn't detect viruses. It's a HEPA filter machine that is just purifying the air in the classroom. These are the temperature taking kiosks. I think you all have experienced them as you come into the building and you just step up and it tells you your temperature and it verbally tells you you're in normal range, or I suppose not if you're not. I haven't been out of normal range. Lots of plexiglass dividers. You see an office area there where those plexiglass became more permanent kinds of structures, and then lots of portable dividers in the buildings. Every teacher has been provided at least one to utilize in their classroom, and all office areas have them available also. This was taken at transportation. I recognize that I was over there the day that these were out for bus drivers. So these are cleaning supplies and disinfectant and gloves and masks and things that each bus driver received before they started driving at the beginning of the year. And they continue to be replenished. N95 masks for every staff member. And we are told we're getting those every week from the state. I don't know that if they've continued to arrive or not. But we have plenty of those. I've actually been encouraging staff to wear them. Not many staff are wearing them, and for staff who are truly fearful and worried, at a higher level of anxiety around possibly catching COVID, they really should be wearing the N95 masks and even face shields. We do have face shields. Every staff member was given a face shield, so those are available for staff use as well if they choose to use it. So then I just wanted to just show you some shots of what it looks like if you're in a school or out and about. We are doing music outdoors typically, and you see the mufflers or I guess masks on the instruments, and this is following guidance that we've received. Our students have been really pretty compliant about wearing masks. Most people say they're surprised at how compliant students have been. Of course, the same students that we need to remind to stay in their seat or not run down the hall are probably the same students we're reminding to wear their mask at all times. Looks like she's trying to wear a mask while she eats her lunch. Yeah. So we're delivering breakfast and lunch to the classrooms. Still, there have been some concerns about the food, and that the food isn't warm enough, those kinds of things. So we've done some work there to improve that. I mean, we're feeding thousands and thousands of students, which we haven't typically done in the past. So there were some bumps along the way with that. So then I'll talk a little bit about accommodations. We're almost to the end, I promise. Employees complete the request form on the website, and then Human Resources calls the employee to talk about their request, and has basically a phone or a Zoom meeting with them. Human Resources determines if the accommodation is a reasonable request. And then we work with the supervisor to implement that accommodation. and the employee receives a letter of approval or denial, or that we're still working on it. In some cases, we've worked back with legal counsel on these. The process that we designed was originally set up in working with outside legal counsel. Typically, priority went to people who have personal health issues under the Americans with Disabilities Act, and then individuals who are at risk for severe illness. So they had some of those comorbidities for becoming sicker with COVID. And then the third area was just other requests that people had. So that might have been the health provider or the home provider for an elderly parent who has lung issues, or maybe they have someone in their home that they're worried about their health and safety. So we had 146 total requests. We have been able to approve 85 accommodations, and approval looks lots of different ways. It might mean additional protective equipment. It might have meant moving to the online learning program. In some cases, people took a leave of absence or moved to a part-time schedule. Additional plexiglass dividers, microphones for people who are worried about having to talk louder with their mask on, additional air filtration, and then offering folks to have more breaks if they needed breaks from the mask, or some of the accommodations. Accommodations that were denied, there were 16 of those. So for example, we had some folks who simply said, I need no more than 10 students in my class or no more than 15 students in my class, and we were not able to honor that typically. Or some folks saying, I can't have any students who have a mask exception in my class. So instead of saying, no, you're not going to have students with a mask exception, we might have worked with a staff member for a face shield and an N95 mask to feel safer in that situation. Some folks asking to work remotely, but we didn't maybe have a position for them. So for example, if you are in a position that doesn't allow you to work remote, we just couldn't approve that. And then there was some request for just, I can't work with 6 children, and I don't know how we monitor that anyway. So, and then we had 33 folks in the pile who just wanted to have a conversation with Human Resources and to ask questions and to share their concerns. They didn't really have any accommodation requests. They just needed a meeting and needed to have a conversation. And then we still have 12 more that are in progress, and we're waiting either for a healthcare provider to provide more information or for the employee to actually respond to our outreach from Human Resources of that communication. So next steps, we've talked about a staff survey, so we need to consider that. I think we got to be really thoughtful to get the questions right, and so we get the right information. We may even want to work with an expert in this area to help us. And then possibly a parent survey, wonder about a student survey. I think we may want to consider another town hall and just give kind of a state of the start of the year here in October or so, where we would just talk about how things are going and share some of the numbers I've shared and updates on that and where we are. And then maybe another video update of some sort from me or from Michael and me. Anyway, those are some things we're thinking about and are on our radar moving forward. And then we want to continue to work with Weld County Department of Public Health and Environment to monitor the data. We want to continue to monitor any new guidance that comes from the state. That's going to be really important. And then monitoring our local data and assessing it and seeing what the data is telling us as we're making decisions about staying fully in person. Or, some people have been saying to me, what would the numbers need to look like to bring high school back every day? So I get that question. And so I think, those are pieces we'll want to talk about going forward of what would the data look like where we would say, we probably need everybody here every day. Or what would the data be that would tell us that we may want to have more students go hybrid at elementary or middle school like we've done at secondary. And part of that will come from that metrics that I mentioned from the Denver Health Institute. They've identified pieces of data that would say to us we might want to consider to go fully remote. Or fully hybrid and then fully remote. We're not hitting those thresholds across the board in any category. So right now, we're appropriate to be open as we are, I think. And then I just want to mention that we've got to continue to support our district health services team. We did add another nursing position. We're having difficulty filling positions. We did ask one of our retired former nurses to come back and help us. 2 of them actually are coming back to help us. One to help us with healthcare plans, so nothing to do with COVID, and then another one to come back to help us with some of the response to COVID. But this is proving to be a significant lift for our health services team and our district nurses and Lori McCarty, our coordinator for health services. So we've got to continue to work to support them so they can do the work they need to do and they stay healthy in doing this work. So that's my COVID-19 update. With that, I'll kick it back to you all for questions or comments. And Annette and Stacy are here to help out.
Thank you, Dr. Pilch. Ms. Pappas has a question.
Can you clarify the UNC practicum student-teacher situation right now? I've heard varying things.
Yeah. Well, and I should first own that I made a bit of a debacle of this. It was my fault. So we had recently had 2 UNC students from 2 different sites test positive for COVID. They were practicum students. So in a staff meeting with a staff, I was asked the question about practicum students, and I said, we are going to have to look at that. We very likely will need to limit them because of what we're seeing, having just had 2. So if you saw 9 up there, staff, I think it was, 2 of those are UNC students. That's a pretty high percent. So I said we're going to have to look at that, and for now, school, if you would like to have those students go remote, please do that. Yeah, that's totally appropriate to go remote. So the message quickly became no practicum students. I think where we've landed now, and Stacy and Nell, correct me if I'm wrong here, is that the practicum students may come into the classroom remotely through Zoom. We're not having them in the building, correct? They're not in the building, but student teachers may be in the building. So.
Okay.
The practicum students are working on the online school, not in the classroom.
Okay.
Remotely. So they're working on a totally different program, but the student teachers, you are accurate.
Okay.
Thank you. And then I also have a question about how it's going with transportation. Have you had feedback from bus drivers of how it's working with kids on the buses? And
I have not heard anything lately about transportation, so let's hold that and see if Mr. Hinson might come join us and see if he's got some information. I'm going to go with no news is good news at this point, because we do a weekly, an emergency meeting twice a week still. And if transportation isn't on that agenda with an issue, I'm going with no news is good news. Now, I will say this, there still is not enough transportation. We are short drivers, so we've had to combine routes and consolidate routes, and there is still a need for more transportation ability than what we have. That is true. But I think it's going well. I'm not hearing of problems, and no one in transportation has gotten sick. No one in transportation has had to be quarantined. Interesting, with all the kids we've quarantined, none of those presumed positive have actually been on a school bus. So we haven't had to quarantine a bus load of kids because of a presumed positive case. So that's been fortunate.
okay, thank you.
Ms. Solis.
2 things. The slide that we just saw, the slides that you just went through, is that something that we can share with elected officials like City Council of Greeley, City Council of Evans?
Do you mean like?
Just the slide portion?
Yeah, this is all public.
Well, no, I know it is public, but I mean just the slide presentation to go directly to them, or can I have access to that? I think there's some officials that don't necessarily watch the whole meeting, don't necessarily go to our website, but that's pretty informational. And it's in a slide thing that, would be pretty easy for them to get and understand. And
Sure. We can share, I can share with both city managers and
Okay.
ask them if they'd like to share it with their city councils. Sure.
that would be great.
Yeah.
And then the other thing, I know that the mask mandate was supposed to expire and it just got extended for 30 more days. Do we know how that will affect schools? And do you see us wearing masks through the end of, or throughout the school year? Or are there any conversations about that?
So I will tell you, I'm glad it got extended because I think that part of our teachers feeling like they can be back is knowing that everyone is wearing masks. And I want to do everything we possibly can to help teachers feel safe and to feel like they can be here. And one of the things we heard loud and clear from staff was a part of that is everyone being required to wear a mask. And I'm certain there's families too that feel that same way, that they feel like their children are safer knowing everyone is wearing masks as well. But we have to have teachers here to be able to do what we do, and masks are a big piece of that. So I don't see that shifting without a significant conversation at this level. We're not required to have masks at 10 years and younger, but we have required it here in the district, and you all supported us in that decision. And so I feel like the masks are an important piece, and so I don't see that changing unless we change it here at this level.
Okay, good. Yeah, I think that's been imperative, and I think that, we've seen some community members that are just tired of it, but I think, making sure that our teachers feel safe and know that we're doing everything, I would like to definitely see it continue, so thank you.
Yeah, and we do have parents who are concerned about the mask. We are still hearing concerns about the mask. You're right, I think some people are tired of them, but we just feel strongly that it is a fairly small piece we can do that gives people much more peace of mind.
Thank you, Ms. Elise. Mr. Talley is next.
My question was about the mask mandate that Rhonda talked about, so thank you for answering that. My next question is around when a cohort is quarantined and when they return, if the parents are not comfortable, do they have the option to go online?
Well, it's not as easy as I'm going online. I mean, they've got to work to make that happen through the online learning program. So it's an individual conversation with that family, with the principal, to really talk about what their worries are. We are almost, we are 3,700 something students now currently online, so just over 20%. So it has continued to grow, but they have to have a deliberate conversation for that to happen. They can't just go and register and move to online.
Okay. But
And the reality is this, guys, we're trying to stop that move to online, because if we have too many families move to online, we're gonna have to start pulling more teachers out of the brick and mortar, and at some point, we could force the whole system to go online. So we're really trying to manage that, and really trying to help families to figure out what is it that that makes them want to go online.
Thank you.
I think Ms. Mueller is next.
I had a question just for clarification. You showed the pictures of the students eating in the classroom, and I'm wondering, is Danielle and the food services team actually delivering far more meals than what is traditional in the past?
Oh golly, yes, thousands more, thousands and thousands more, yes.
How is the team doing with that increased demand? I'm
Well, they're
concerned
not,
by that.
we're not doing full meals. We're not doing salad bar and, we are doing full meals, but we're not doing the full variety that we have done. So they've been able to keep up. Our model typically is the centralized kitchen model anyway. So their work has just had to shift. So rather than being in the kitchen and in the kids coming through the line and paying for their meals, those folks are deployed out delivering those boxes of meals at the schools and things. They've done a remarkable job, honestly, Pepper. They've been amazing getting the amount of food out that they've gotten out to families and to
Well,
kids.
Please convey our appreciation,
Yeah.
because they do work very hard.
Absolutely, yeah, it's been remarkable.
I do have one other question. I've had some community members ask, there is a difference in reporting in different organizations across the community and the county. I know, for example, UNC's way of reporting COVID cases is different than the district's. And I think in the paper, sometimes people see that groups are being quarantined and they assume that that means that those students are positive COVID cases. And so I guess I just want a little bit more articulation that we are really using presumptive positive as sort of our guideline for when we quarantine, correct?
Yeah, absolutely. And I will get that out to you guys again, that flow chart, so you can see it. Christine, if you'll help me to do that, so you can see what how what was the term that one of our nurses used? Our tool is, it wasn't, what was, this tool is not nimble. I don't remember the term she used, but she's absolutely right. Yeah. This tool is too sensitive. And so it was a term that one of our nurses used. The tool is very sensitive. And so you move pretty quickly to quarantine unless you have a negative test. So unless symptoms have resolved in 24 hours, or you have a negative test and an alternate diagnosis, you move to quarantine pretty quickly for everybody who was around that individual. So, and this is the guidance from CDPHE. So it's not CDC guidance, it's not Weld County guidance. It's the public school guidance from the Colorado Department of Public Health and Environment.
Okay.
And it's very sensitive.
That individual may not have even tested positive, they just may be symptomatic.
Right, and even just to go back, we have fewer than 20 positive students and fewer than 10 positive staff who've actually tested positive.
Thank you for that clarification.
So we have many negative tests where we don't have an alternative diagnosis and symptoms did not resolve in 24 hours, and we have had to quarantine. Many of those.
I would just add on that too. So I think that is the perception that if you have a cohort out, that's COVID spread. And so anything that we can do to keep communicating that not everybody has COVID, this is the process, I think that would be helpful.
Yeah, I appreciate that. Yeah, it's the conversation we have every week. All right, and I'll be frank, I was disappointed, and Ann's in the room, but I was disappointed that the Tribune ran that 2 schools were closed because of COVID-19. There is not one confirmed case at those 2 schools. Those 2 schools are closed because of the high number of absenteeism at those 2 schools, and the possibility of COVID symptoms. And so it's we're going to continue to work on helping people to understand this, because you're right. I think people see, oh my gosh, there's an outbreak at this school if the school had to go remote, or if you have 2 cohorts out, that must be an outbreak at that school. We're not at an outbreak at any of our sites at this point. So an outbreak would be 3 or more COVID confirmed cases without a known relationship. So for example, that would mean 3 confirmed COVID cases at an individual school of students or staff who are not in the same cohort. So they didn't get it in their cohort, so now it's spread across cohorts. That would be a possible outbreak. At which point then we'd work with the health department on determining if there's a recommendation to have the whole school go remote. But we haven't had that yet in any single school.
Ms. Mash.
I just wanted to comment also that there is no provision in that sensitive tool for, snowing ash for
Right.
wildfires and things like that. Just how many students and staff and just general population are probably experiencing symptoms from that.
So if you coughed for 5 days, if the students' parents reporting they've been coughing now for 5 days, they're past that 24 hours of it being resolved. And so they could get a negative test. That would be helpful, but we also need the healthcare provider to say, this is asthma, or this is allergies instead of COVID. So that's tricky, because, you know,
Wrench in the works. Yeah.
it really makes it complex.
And then add in allergies.
Yeah,
Right.
right.
And also the symptoms are so widespread in terms of if you have vomiting and diarrhea, that is also two minor COVID symptoms. So it covers so
Yep.
much, which obviously is helping us to keep kids safe. But so those were just comments. Sorry. My actual questions. I was wondering if our air purifiers are now a part of our like IT or building maintenance, because I did hear of one that has already stopped working at Fred Chargas.
Huh. Well, I hope they've let somebody know that.
Yeah, I hope so too.
Yes, so.
It was replaced.
It's been
Okay,
replaced,
cool.
yeah. There's a system for that. And I would see us continuing to have air purifiers even after this pandemic. I think this is a good thing that has come out of this pandemic, and a good use of our CARES Act dollars to be able to have these air purifiers in our buildings.
Agreed.
I was also wondering, and if this is helpful data later, but just curious of what's the breakdown of high school, middle school, or elementary students that have been quarantined? Like, do we tend to notice that we're having more?
We are quarantining more at the elementary, no question about it, and then at 2 middle schools. So Franklin and Heath have been hit harder with a couple of cohorts out at a time, but you know, it's 2 cohorts out of 12, I'm guessing, ish, maybe 16. So, but we are seeing more at elementary. We actually have more confirmed cases at high school. But the hybrid schedule is working well to prevent the quarantining, because we have that 5 days where kids are not in school at a time, so where one cohort is not in school. Mm-hmm. So that gives us a nice cushion in there to maybe not have to quarantine students.
And then I wondered if it went out to families at all, that there are those quarantine updates on the website, just because I have heard.
Yeah, we did.
Yep. Okay. So that is great for getting the correct information. You know, you just hear sometimes with general talk of like, oh, this school's closed down, or this or that, and it's like, well, actually, it's just a cohort, or you know, so
Right.
People can keep themselves up to date by checking our website.
Mr. Hafley.
Thank you. Dr. Pilch, how much total CARES money have we spent since we received it?
All of it.
Okay, and how much is that, please?
I don't know.
Ballpark, please.
Photo frame.
4 million is what Teresa's saying. I want to say, well, there's 2 pots. So I want to say, well, let me just text Megan, and we'll get it exactly.
Mm-hmm.
There's
you.
2 pots of money. There's there's the COVID relief funds, and then there's the CARES Act dollars. So the bulk of the dollars had to be spent by this December 30th. Then there's the other pot of dollars that we can spend going forward. But I'll find out. I can't remember. Oh, 14 million. So it was 4 million for the relief funds that we can carry over, I believe, and
Okay.
10 million is what we had to spend between March and December 30th, I believe.
And we've spent that already, am I correct? Okay.
More. We've
Well,
we've
that's what I
spent
thought.
beyond that to address all the needs. Yeah, we've spent well beyond it. And I mean, you saw the pallets and pallets of things that we bought to
Yeah.
do that. So we have far exceeded the 14 million.
Okay, thank you. Let's say that Dr. Dattery has a middle school room and she has a cohort of students. Who can visit her classroom during the course of a day, either at the administrative level in the district or an administrative level within their building?
Well, it depends what the needs are of that class and those individuals. We have sent the message that we want to significantly limit the number of visitors into classrooms, significantly. Part of that then for administrators, they're doing evaluations remotely in some cases, and then they're limiting which administrators are in which rooms and for how long each day to stay under that 15 minutes of cumulative time in the classroom. But you know, we are dramatically limiting additional adults from being in classrooms.
That was my question.
We just have to.
How were evaluations being completed? And then my other question would be then, if we're limiting time, is CDE allowing any leeway, and is it still SB 1891?
So we have not been given reprieve on teacher evaluation at this time. However,
Okay.
I spoke with the principal at the end of last week, and what that principal is doing, so they're figuring it out. They're going in the classroom for under 15 minutes today, and they'll go back tomorrow for under 15 minutes, and maybe back the next day for under 15 minutes. So they've observed, you know, a total of 45 minutes, but it's been over 3 days. And then there's some observation taking place remotely as well.
Okay. And what is the testing amount, or what kind of testing are we using for the evaluation, or has that been determined at this point?
So there was a safeguard put on the use of the data
Okay.
this past spring. Annette, why don't you take that question on? Have we been told on data this year?
Yes, the data for this year is going to be pushed off. We're going to hold on this year's data because we didn't have it from last year, so we're not going to have it to be able to use in an evaluation this year, but we will still use the professional practices.
So there is no state test data to use.
Right.
Okay, and that was my question. So the professional practices, and they've figured out a way to adjust and modify to do their observations, and then, okay.
That's right.
That's what I was asking. Thank you very much.
I don't see any other questions. Dr. Pilch.
So Kent, there was a question about transportation and how it's going with transportation. I said, well, I'm not aware of anybody getting sick.
No, well, it's actually going okay. So we started the year down 16 drivers, so we're limited there. And we're running at 2/3 capacity. So we're running, I think right now, we're running 43 routes. And we're adding routes weekly as we work on the registration process and contact people that have been non-riders, signed up to ride but are not riding, and then we're looking to add more routes. In some cases, we're doing double routes. So we work with the principal to make sure, say, if we run the second route, if we get here, 20 minutes later, we have to then come back and pick up. So we're adding those. I know we added one today for Brentwood based on need. So we're really trying to hit our areas where we know transportation is important as a priority. We just got a driver off of medical leave today, so that's good. So we can add them into the pool and then start filling that. But it's gone reasonably well. We've asked parents that if they can to help transport their kids to school, and obviously being 2/3 full for bus drivers' safety and everybody's safety. It's cohorting, similar to what we're doing in classrooms. But we're taking calls and monitoring needs and working with principals and adding as we can.
Thank you.
Okay, yep.
Dr. Pilch, I have a question, and this is probably a difficult one to answer because it's probably all over the place. But how are our building administrators feeling about the start of the year? What's the general sort of consensus?
So in general, building administrators have thanked us for allowing them to be open. That's in general. And have sent emails and text messages and voicemails saying thank you for allowing us to be open. And even after, last week a school had their first quarantine, the principal called and said, even though I have 23 students quarantined, I just want to thank you that you allowed us to open, because I only have 23 students who are not here. Everybody else is able to be here. So I think in general that is the sentiment. And now, having said that, I think they are very tired. I think they are they are under a great deal of stress at schools where they have had multiple cohorts go out, like Franklin and Heath. I think it's very stressful. They're covering classes. They're trying to figure out how to do teacher evaluations in this new environment, and they're covering classes, and they're notifying families about a quarantine. So it's there's no question that we're asking everybody to work harder and in different ways than they've ever worked, and that takes a toll on people. There's no question about it. So we're trying to figure out what can we do to take some things off their plate, and it's really hard to find things that can come off their plates, because the work of the district still has to continue. And that's what's so, I think, hard about this pandemic for everyone, is the work we all do every single day, whether you are a custodian or a bus driver or a classroom teacher, a secretary or a building administrator. You still have to do all of that work and all of this other work that is a result of this pandemic. So there's no question it's incredibly stressful for some, and some are holding up under that stress better than others, just like all the rest of our staff, I'd say. So thank you for asking.
We also have a question from Ms. Elise.
So it's not really a question, but just a thank you for the information, and please give our thanks to all of our staff. We can see these numbers, and they're numbers, but we know that there's a lot of work that goes behind all these numbers. And I appreciate that when someone brings some concerns, or, this isn't going well, or I have a question about this is not happening, that you address it right away, because I think the sincerity and the urgency that you've shown in this really helps people try to put some of that stress away. It doesn't take it all away. But please thank principals, thank our janitorial staff, thank our teachers, thank your staff, just everyone working so hard. We recognize that, there's a lot of work that we don't even see, that we don't even know, just from the work that we all do. I remember having this conversation that the first couple of weeks are going to be extremely stressful, because you're so paranoid that you're not doing everything that you should be doing. Did you miss something? Did you forget something? So please let them know that, we think of them daily, and just our hearts go out to them, and we're so appreciative of all the work that they do.
Yeah.
You okay? You got a question?
Just one thing.
Okay.
I just got a message from a friend in South Dakota who must be watching, because they asked for some clarification. And
your mom.
It's not my mom this
I
time.
have a responsibility to answer to South Dakota, Mr.
I
Jones.
know, but they just asked, and they're an educator, administrator in South Dakota, and they said, could you please clarify, because they read two different articles about one when we were choosing to go online for, I'm guessing that was Jackson, and then one where they read schools are closing. And I know the answer to that, but could you clarify, is there a difference between we're closing a school and we're going online for an X amount of time?
Say that again.
Is there a difference between an article that says we are closing this school,
Yes.
or we are going online?
Well, we tried to do that. We tried to say we're going remote. This school's going fully remote rather than closing. But the reality is we closed the buildings. So it's a delicate dance. So we closed the building for 2 weeks because we needed, in the case of Jackson, we needed to get people away from each other, because we believed there could be significant spread there, just based on the adults who had tested positive. The 2 adults tested positive, and 3 others were very sick. And these were adults who had had a lot of contact with a lot of people. So in that case, we actually said, and we did the same thing with Martinez and Madison, because the number of absenteeisms we had was, we said, everybody goes home for the next 2 weeks, and make sure that we stop any further potential spread of whatever this virus is that is causing all this coughing and sneezing. So I think, we'll continue to nuance that messaging, because we are coming back. Just today. We brought Jackson back. We're bringing Frontier back tomorrow. We plan to bring Madison and Martinez back after their 14 days, so we do plan to come back. So we need to figure out that language. Thank you for that.
Are there any other questions from board members? All right. Well, thank you, Dr. Pilch. I mean, not just for the presentation, but for everything
Thank
you guys
you.
are doing. We know that it's a lot. That's an understatement. Our next item is our community engagement, and just to check in, and we may or may not have any information from board members on community engagement, but I'll just open it up to the board to share if there's anything that we need to address or anything that you've been addressing in terms of community engagement. Mr. Hafley.
It would be easy for the Poudre Learning Center to just kind of hang out by the Poudre River and just watch the eagles and the osprey. But they've been very, very diligent. They're bummed that they aren't able to see the 36,000 students they saw 2 years ago. But what they've been doing is Amy Nickel and Ambrette Gilkey have done a great job of using standards-based lessons, and they're trying to share them with our science classes within the district to give them other opportunities to present science in a different manner and using the outdoors as the Poudre Learning Center always does. So they've done that. And then I also sit on Catholic Charities Farm Housing Board, and Ms. Mash spoke to the folks out there about COVID, but we've also, Jesse Chiarina has done a great job of translating things and being able to share about COVID. And we really appreciate that, and the district has been very helpful in a lot of ways, but they've been spectacular, and I really appreciate it.
Thank you, Mr. Hafley. Any other questions or comments from board members? It is probably a good time to thank our community partners, and there's another one. The IRC has just been incredible for this district in translating everything that needs to get translated, and so I just want to say a quick shout out to the IRC and to their staff for everything that they've done for us over the last. We have sent out a lot of communication, and they've done a massive amount of translation for us and for our students and families. So thank you to the IRC as well. That's I think all we have on community engagement, and then we're to debrief the work session. And since we started to my left, we'll start to my right, and Ms. Mueller, let you lead off.
So there's one thing I failed to mention during the comment section, and I don't want to be remiss in saying that I had the opportunity to go to our last summer graduation with the Greeley Alternative Program, GAP, and it was terrific. I was so excited to be there, so pleased to see these students who, many of them have overcome a lot to really graduate and lean in and do their schooling sometimes at night after work, and I'm just really proud of all those students, and it was a pleasure to be there. Thank you, Dr. Pilch, for the debrief on all of the COVID-19 facts and numbers, and I really appreciate that. It is difficult sometimes when you read the different reports or news to know what it means. So I do think that always maybe constantly reminding the community of what the meaning of those numbers mean is going to be really important for us as a board, and of course for Ms. Meyer's team and just all of us to constantly be talking about what those meanings are, because I think people jump to the conclusion that means outbreak, or that means that we are rampant with COVID all over Weld County. And so I think we do need to continue to have those conversations with community members and with other officials within the area. And so I really appreciate you being very succinct and very specific about how we are quarantining students. Thank you.
Thank you, Ms. Mueller. Mr. Hafley.
Again, I need to thank the board and Dr. Pilch for being able to work cohesively as a team. It's a pleasure to come here and work whenever we get that opportunity. And the other people that, and Ms. Solis talked about it, but our staff needs to really, really be lauded for the incredible efforts that they've made during the course of this challenging time. And they've stepped up, and again, like we talk about, it's about our students, and all means all, and they've embraced that, and we need to celebrate that whenever humanly possible. A shout out to all of them as well.
Ms. Elise?
Great work session. These are tough times, and to know that we take this so seriously really puts my heart and my mind at ease a little bit. This was not an easy decision for us to come to as a district, and I appreciate that we continually monitor and go over this information and make sure that we're doing everything we can to keep people safe. And I guess that's kind of why I wanted to make sure and share that information to the different councils, because I think it's really important for them to understand and know how seriously we take this as a district and how protective we are of their citizens and of those citizens' kiddos. And that, I feel as though we are the example of a large entity that decided to come back and really had a plan in place and really have worked hard to do this as well as possible under circumstances that have been so uncertain. So I'm just really proud of our district. I'm proud of our employees. I'm proud of our teachers. I'm proud of our students for wearing masks. That's really impressive to know that they're all working so hard that so we can still be here. And I think that's the biggest thing out of all of this, is that we're all trying to do our part in our effort to make sure that we can all still be together, and that kiddos can be in-person learning, because we know that that's the best for them. And so I just appreciate everyone's efforts in this. And again, please thank our staff in all levels for all the extra work and stress that they've been going through.
Ms. Pappas?
So I think we're all saddened by the fact that we can't get into schools and do our usual visits. I did reach out to my new schools at the beginning of the year, and just welcomed the administrators to the new year and introduced myself as their new liaison. And I did put a statement there, just let me know if there's anything that you need or anything I can do. But I don't necessarily think that a principal would contact me with something that they could maybe use, or maybe I could do something to help. So I don't know how you feel about that, of giving them permission to just say, maybe our teachers need donuts one day, or something that would just help. I don't know what that looks like, but I'm just wondering.
When you said you'd go sit in the classroom, Terry, I almost took you up on it.
Yeah.
I mean, I would have, had we not gotten that covered. So I think for someone like you who's willing to do that, I think that's helpful. I think food is helpful. We got to make sure it's individually wrapped.
Right.
Like, we don't want to drop off a box of donuts that people are going to be reaching into.
Right.
I think food is helpful, but thank you for that. And guys, I think you've expressed tonight I'm going to capture some of your language around the appreciation for staff and try and put together another message to staff on behalf of you all and me. But I think it'd be great to just reach out to the administrators and just say, you're doing a good job, and I know how hard you're working. I just wanted to let you know I'm thinking about you, and if I can, do something for you, let me know. I think that'd be great to do that.
Thanks.
Thank you, Ms. Pappas. Mr. Talley?
I really appreciate the presentation. There's a lot of information, and it really broke it down for somebody who hates numbers like myself. And so I really appreciate that. I do really want to say thank you to the schools. Particularly, I want to shout out to my son's school. I know that having a child who does have significant challenges already and struggles in an academic setting, for him to wake up every morning and come wake me up, even though it's at 4 a.m., but he wakes me up and he's excited to get ready and go to school. It goes to say a lot about the school and the administrators and the teachers and the support staff that are working with him every day. And so I'm more than grateful for all the work that all the staff and support staff and administrators are doing in the schools. And I just, it's hard to put it into words, but very, very, very grateful. And so happy to have a son who is excited to go to school still, and it's almost October, so.
Thanks, Ray.
Ms. Mash?
Yes, thank you very much for the update, and I really do like numbers, so I like to see all the data and not have to try to extrapolate it myself, so thank you for that. Yeah, also want to say thank you to all the staff who are working so hard. I want to both recognize that it is very hard work, and also that it's going, as well as it is. So my children both are loving their years so far, and the only complaint is that my daughter's not in school full time. She's just like, when do I get to go 5 days a week? So she loves it when she's there. So.
Thank you, Ms. Mash. And yeah, great work session, guys. Thank you for all the information, Dr. Pilch. It is really helpful to know that we have 22,200 and some odd students, and we've had 15 confirmed positives. And I don't know that that's, again, when people read all the things, that I don't know if that's the impression that they get. So it's good to have that information and be able to share that information. So thank you for the information, and thanks to our building administrators and our teachers for sure, and all of our staff. So thanks everybody. We'll adjourn the work session, and we'll be back at 6.